morning, everyone, and welcome to our second annual State of Hunger. My name is Georgia O'Farrell, and I am the Development Director of the San Diego Hunger Coalition. We're so happy to have you join us this morning. As we get started, I first want to encourage you to join us on the chat. You're welcome to post questions there. We do have team members who are monitoring the chat to make sure your questions are answered. We also want to encourage you to share on social media about the State of Hunger, as well as Hunger Free San Diego. You'll be hearing more about it today, and I know we have a lot of partners on this morning who I'm sure are very familiar with it. But please notice our unique hashtag HungerFreeSD that you can use on your social media posts. So as we get started, we first are going to launch a poll. We really want to see who all is joining us today. So you'll see poll questions launch on your screen if you wouldn't mind quickly responding to those 4 questions. I see we're getting a lot of responses in. Thanks so much. We still got about 50% of our attendees answering, so we're going to wait a few moments here. Just a few more responses coming in. Thanks so much for your patience. All right, so we're gonna move along here. It is my absolute pleasure to introduce Anahid Braki, the President and CEO of the San Diego Hunger Coalition. Prior to joining the Hunger Coalition in 2015, Anahid worked for more than a decade in San Diego's philanthropic sector as a program officer and grant maker focused on alleviating poverty and strengthening nonprofit collaboratives. And she is a co-founder and the founding chair of San Diego Grantmakers Food Funders Collaborative. Prior to joining the nonprofit sector, Anahid spent 5 years as a data analyst for a financial software company and 7 years in hospital administration while she put herself through school. As the CEO of the San Diego Hunger Coalition, Anahid applies her knowledge of the local landscape and expertise on poverty, systems change, and data management to foster collaboration and drive innovative solutions to end hunger in San Diego County. It's my absolute pleasure to introduce Anahid Braki.
Thank you so much, Georgia. Welcome, everyone. I see we have 155 people here today. I wish we were all in the same room. It's always hard talking out to the stratosphere, but I know you're there. I see the numbers and I feel that you guys are with us. So welcome and great to have you. So none of this work would be possible without the generosity of philanthropy, and today would not be possible without the generous support of Kaiser Permanente. Kaiser Permanente is the title sponsor for our State of Hunger event this year. And they've also been a major funder of Hunger Free San Diego over the past few years. Next slide. In addition to Kaiser, some of the other major funders of Hunger Free San Diego over the past 4 years that I wanted to acknowledge. First, we have an anonymous couple who gave us a significant gift this year to be able to produce the maps and analysis and the initiative that we're going to be presenting to you today. Thank you so much to Vince and Candace Kasparek, who have been stalwart supporters of this initiative since the very beginning, to Price and the Moxie Foundation for supporting this work year after year, and to the Charles A. Freoff Foundation, San Diego Foundation, and Jewish Community Foundation for your continued support. Thank you. So I am so excited today about our guest of honor. She doesn't need much of an introduction, but we're going to share with you some of the incredible things that she's done for hunger relief. I'm going to be turning over the mic, so to speak, to one of our co-chairs of the Hunger Advocacy Network, Ms. Vivian Preciado. Vivian is the planning and programming coordinator for Housing on Merit. She's an emerging leader in affordable housing through the National Housing Conference, and she's a member of Mana de San Diego, which is a national Latina organization. Vivian has served as co-chair of the Hunger Advocacy Network since June 2019. She will be continuing this year. Thank you so much to Chris Carter for his service as co-chair. He will be stepping off this year. And with that, I'd love to turn it over to Vivian.
Thank you, Anahid, and good morning, everyone. It is my privilege to serve as co-chair of the Hunger Advocacy Network, or HAN, which is facilitated by the San Diego Hunger Coalition. HAN is a collaborative of 17 health, housing, and social services agencies advocating for state and federal policies to end hunger. Ending hunger in San Diego can only be accomplished by large-scale system change. Over the years, we've been honored to work with Representative Susan Davis to address hunger. Throughout her tenure in public office, Susan Davis has been a consistent champion in the fight against hunger. Throughout her tenure in public office, Susan Davis has been a consistent champion in the fight against hunger, Congressman Davis knows that well-fed children engage and learn better in the classroom and has been an incredible advocate in combating child hunger. Representative Davis introduced the Stop Child Summer Hunger Act to provide families money to purchase groceries to replace the meals that children would otherwise receive at school, a model for current pandemic EBT benefits. Representative Davis has long worked to address hunger in the families of our men and children in uniform. Men and women, I apologize for that, no children in uniform. She fought for legislation to level the playing field when it came to SNAP eligibility for low-income military families living in areas with high housing costs like San Diego County with the Military Hunger Prevention Act. Most recently, she has been working with Representative Mike Levin to draft the Military Dependent School Meal Eligibility Act to directly certify low-income housing for families and thereby increase their access to free and reduced meals. We are particularly grateful for the leadership that Congresswoman Davis has shown during the pandemic. She co-sponsored HR 7794, which is the Emergency SNAP Flexibilities Act, which was enacted as part of the continuing resolution, making CalFresh more accessible to all who need it. She urged the USDA to extend school meal waivers through various acts of administrative advocacy in partnership with HAN. It is now my honor to introduce our guest of honor, Representative Susan Davis.
Thank you, Vivian, for that very kind introduction and for this tremendous honor. I want to just wish all of you well and thank you for all the work that you've done for so many years. I'm so glad to be here.
Congresswoman Davis?
Yes.
Are you able to adjust your camera so we can see
your
face? There we go.
Sure.
Fabulous.
Is that better?
Yeah.
Okay.
I know you
Great.
just ran out from the floor. Thank you so much.
I was looking over this way. Great. Thank you. As I was saying, I am glad to be with you today. And of course, we're all used to speaking virtually. It would be much better to be with you all in person, but we understand that. And we certainly respect the need to do it this way. I know that you have all been involved in a number of issues that impact so many in our communities. And I really want to recognize that, especially during this crisis. It has not gone unnoticed. When the stay-at-home order came down, you were the first to react to the needs of many who were out of work and hungry. You set up food distribution centers, organized donations, and advocated based on what you saw firsthand San Diegans were facing. And we've seen how much you can do with the limited resources that you have. We've just got to recognize that more needs to be done. And in Congress, we've been working to get more relief to our communities. As you well know, we passed the updated HEROES Act, which includes an increase to the maximum SNAP benefits, additional funding for nutrition programs. We're continuing to press the Senate on this. Get a relief package soon. I wish I could say I was coming tomorrow. On the Education and Labor Committee, I'm asking that we move forward with lessons learned from the pandemic. As you know, once again, the first COVID relief package included a pandemic EBT card that was issued to students who receive free and reduced school meals. We're looking at the success of pandemic EBT to pave the way for passage of my bill, Stop Child Summer Hunger Act, which would create a nationwide summer EBT program and provide a card for children who receive free and reduced price school meals during the summer months when they're out of school. This is so important because no child should go hungry, and no parent should have to worry about being able to feed their child. Another area to look at for lessons learned during the pandemic is in universal school meals. Congress authorized a number of waivers to allow schools the flexibilities they need to feed children outside of school. And honestly, I was amazed at how schools pulled their resources together to make sure kids could get school meals even when their schools had closed. I know my colleagues are looking at how these programs have worked to feed all children. And I'm hopeful we can continue to move the needle on this issue. It is promising. Lastly, an issue that I've been working on for many years is hunger among lower income military families. Military families already sacrifice so much for our country. They shouldn't sacrifice meals. But despite pushing for years to get data, the Department of Defense has not shared what we need and often not need to know. So we can act. Act as if there is no problem here at all, but we see it right in front of us today. We see military families, you see military families lining up in food banks on bases across our country. I've been working closely with my colleagues on the Senate side, and I think there's a real opportunity to make progress on this issue. But some days, honestly, I'm not so optimistic about that. I am leaving public office confident in the work that my colleagues are doing. And I know that you are all out there and you will be working hard every single day to be sure that we do everything in our power to help our young people, our families, our communities to find the housing and the food security they need to be the very, very productive people that they want to be. Thank you again for everything you all do.
Congresswoman Davis, we are so grateful that you were able to join us today. Your work on the summer EBT through your Stop Child Hunger Act, I think without that, we wouldn't have had pandemic EBT. If you and other leaders hadn't been pushing the concept of summer EBT for years, along with all the other hunger issues that you've elevated, we wouldn't have had that, so many families wouldn't have had that. So thank you for that. And I want to say to our listeners, Congresswoman Davis just outlined how important some of these federal nutrition programs are and how hard she and others are fighting to expand them and make them more flexible and to increase the benefit amounts. Please sign up to become a Hunger Free activist and add your voice in support of what Congresswoman Davis and our other elected officials are doing in Washington, D.C. Thank you again, Congresswoman.
Thank you.
It's such an honor. Our goal is to make sure that everyone in San Diego County has enough to eat in their time of need. We want to eliminate hunger as a barrier and another contributor to the cycle of poverty.
Today, the coronavirus crisis moving at a dangerously fast pace.
For the second straight day, the U.S. has now topped more than 77,000 new coronavirus cases in a single day.
Now, due to school being virtual, businesses closing, job losses, rising food costs, there's a dramatic increase in need for food assistance.
Distribution sites are witnessing an unprecedented demand with 40 to 50% increased need on average.
Nationally, 1 in 3 children and youth are living in food insecure households.
It is an issue in our community, and under these circumstances, it's even more compounded.
CalFresh, which is California's name for SNAP, formerly known as food stamps. And I want to say, this is the best time to apply for that program, even if you just need it for a couple of months.
It was done almost immediately after the pandemic started. School districts like San Diego Unified providing meal pickups for students now learning at home.
We now have 26 sites delivering nearly 60,000 meals every day. We've surpassed the 2 million meal mark.
So now that schools are closed, the San Diego Foundation saw this as an excellent opportunity to get meals flowing back into the community, back to those communities that don't have access. And so we're really grateful to partner with them.
Taking 30 of our existing pantry sites and turning them into super pantries. So that means more frequent distributions, more food, and then we're building capacity.
The pandemic EBT benefit provides $365 per child. So any household with children who were receiving free or reduced price meals or attended a school that was serving free meals to all kids is eligible for this program. That's an estimated 250,000 kids in our region.
Muy importante mencionar que este programa no va a afectar de ninguna manera la carga pública.
Me quita un gran peso porque pues uno nunca sabe qué emergencias se puedan presentar, entonces por lo menos ya tienes ahí asegurada la comida de tus hijos.
Numbers have just skyrocketed, so we're seeing a really large increase and people are coming through on a daily basis to our drive-thru. We're serving over 1,000 meals a day through our drive-thru.
Our meals have quadrupled. I mean, we're doing we'll deliver 10,000 meals today to very hungry and needy seniors.
We have so many fantastic organizations in San Diego County working as hard as they can to fight hunger.
The simple reality is no one in America should ever go hungry. And a lot of folks are working really hard to try and ensure that's a reality.
County Supervisor Fletcher said it well. No one in America should have to go hungry. So let's start here in San Diego County with creating a hunger-free San Diego County. So we're hoping that you're gonna have to forgive me today. I think we all, it's pandemic events during a pandemic. And providing research, doing new research and keeping up with all the changing programs. I think I speak for probably every single person on this webinar today that it's been a long haul. It's been a long year. So the purpose of what we're providing here today is to look at how we can provide more resources and bring more food into the existing programs that we all have. We want to bring more resources, more food to support what you're doing. And we also want to make it easier for anyone facing hunger to quickly connect and navigate through our system to get the help that they need. Next slide. So, what is new this year? We changed our methodology for how to calculate food insecurity. In the past, we were using the California Health Interview Survey, which is like maybe too much information, but suffice to say that there was a delay in the data. It's a survey, but the survey results were never available until at least a year after that year had ended. You know, obviously we're in the middle of a pandemic. We're trying to respond and pivot quickly to the changing landscape. So we really needed a new way to be able to estimate food insecurity and estimate the total need that we're trying to meet on a monthly basis. And we also needed to be able to do that at the zip code level so that we can really start to dial in with our solutions. So the other thing that's new is a whole series of maps. Last year, we provided a pie chart to show you the landscape of food assistance in San Diego County and where the meals are coming from. This year, we are putting that on the map. And so we're looking at meals and food insecurity and the meal gap by zip code. And again, the emphasis today is on sharing this brand new data with you, which we are it's continuing to evolve. It was evolving yesterday, so bear with me as I stumble through trying to capture the significance of it for you and to translate it for you. After I'm finished with this macro level look at hunger in our region and a macro sort of approach, I'm going to turn it over to our VP of Programs, Amanda Schultz-Brochu, who will lead us through how we can create a hunger-free San Diego on a more micro level, on whatever that micro level is for you, whether it's a region, whether it's a city, whether it's a neighborhood. We hope that the new initiative and this data that we're providing today will enable us to close the meal gap in every corner of this county. Next slide. So the question is, how many people in San Diego County don't have enough nutritious food to eat? Next slide. So I want to clarify that when we're talking about the food, when we're looking at these estimates that we're about to get into, we are talking about the total population of people who are currently experiencing food insecurity and hunger, and those who are at risk or very likely to be relying on and receiving food assistance. So we're including the population that defines who self-reports as food insecure, the population who reports as food secure, but they are relying on food assistance to have enough to eat. And then we're also adding in the people who are living in economic hardship in our region, who are likely to rely on food distribution, school meals, et cetera, on a monthly basis so that they can make ends meet. So that population, we are defining economic hardship as below 185% of federal poverty level, which is $48,000 for a family of 4. We decided to go very conservative with our estimates. So keep that in mind. We're going to look at some big numbers, but we feel very, very confident in these numbers because we are trying to be on the err on the more conservative side. Next slide. So a quick look back at pre-COVID, just so we can ground ourselves in the population and the experience of people who are facing food insecurity and hunger before COVID and the greater population who's experiencing it now. So pre-COVID, we were looking at about 1 in 7 San Diegans. Food insecurity had really started to drop. And so obviously that's now reversed, and we'll look at that trend. But as we think about how we identify and hone in on communities of our most vulnerable communities, we know that 50% of food insecure individuals have a disability. 55% of food insecure individuals were employed in 2017. And 43% were working full time, which sounds crazy until you learn that a third of San Diegans were earning less than $14.35 an hour. So not only was the food insecure population, most of them, over half of them were working. Unfortunately, they were working in, a lot of those jobs were in the industries hardest hit by COVID. Next slide. So as we're looking at unemployment, food insecurity already is experienced at disproportionate levels for communities of color. And COVID-19 has further exacerbated that. And we know that by looking at who has been most affected by unemployment. For the Black community to make up 5.5% of the San Diego County labor force, but almost 33% of the claimants is an incredible, terrible disparity. Next slide. Another factor that influences food insecurity is income level. And you see it at play right here, where nearly 70% of the unemployed, of newly unemployed individuals have a high school degree or lower. Next slide. Talking about child food insecurity, pre-COVID, we had dropped to a rate of 1 in 5 children living in food insecure households. Kids made up a third of San Diego's food insecure population before COVID. Half of our public school students are living in households that are basically living in economic hardship under that 185% of federal poverty level. And 40% of CalFresh recipients are under the age of 18. This is pre-COVID. New slide. So you've been seeing different reports, I'm sure, different surveys and research that's been done on the national level. Nationally, 1 in 3 kids in the US are now living in food insecure households. About 41% of households with young kids are food insecure, up from 15% in 2018. And then again, with the racial disparities, the new census data indicates that 40% of Black and Latino families are now food insecure, whereas the rate is 22% for white families. Next slide. For senior food insecurity, seniors, older adults are so proud, and they don't want to take CalFresh, and they don't want to admit to being food insecure. So when we look at the self-reported food insecurity rate by seniors, it's 1 in 10. We know that probably 1 in 4 seniors, even pre-COVID, were at risk because they earned less than, in this case, we use 200% of federal poverty levels. So 1 in 4 seniors earning very little money, not earning, but fixed incomes. Next slide. And so what that means during COVID is that while the population of older adults didn't have income loss to exacerbate their food insecurity, they have access loss. So congregate meal sites and senior centers are still closed. Health concerns prevent grocery shopping. There's a high delivery fee for grocery delivery, and isolated seniors are a real community of concern. Next slide. So we created so in order to create these estimates for 2020, and I'm just going to very quickly talk about the methodology. I know a lot of you on this who are with us today are interested in the methodology, and we're going to be posting that to our website by the end of the week, so you can really dig into where some of these numbers have come from. But just very quickly, we started with the population living in economic hardship in 2019. Our new amazing data analyst, Catherine Link Oberstar, created a regression analysis that demonstrated statistically the connection between unemployment and poverty level. And we used that with our current unemployment levels to model out what food insecurity likely looks like right now in San Diego County. Next slide. So here are the results. So and again, this is the total population in need. This is the population currently experiencing food insecurity and very much at risk. So we started in January pre-COVID with about 1 in 4 people falling into that category. Again, remember 30% of working age individuals earn less than $14.35 in San Diego County. Vivian, will you hit mute? And the, so here we are in August, 31%. So 1 in 3 people facing food insecurity, 41% of kids. So we're looking at over 1 million people, and that's who we're trying to serve right now. Next slide. Looking at this graphically, you can see how the curve looks. We peaked in April. We decided to look at 3 points in time. So the maps and the analysis and the data that we've gathered will show you pre-COVID, January, April, which is the peak of unemployment, and then August, which, as you know, just a couple months ago, uneven reopening, some recovery in employment. But that's where we were cut off for our data collection. Next slide. So here's food insecurity by zip. So I'm going to show you 3 maps in a row, and then we'll show a slide that has all 3. So notice that the legend is, this is based on number of people. It's not a rate. We feel that dialing in with the number of people in each of these zip codes will enable us to really get even more specific and targeted with our efforts and resources. So the very darkest green is 30 to 55,000 people. The next darkest, like El Cajon, 20 to 30,000 people. Lakeside, just above that, 10 to 20,000 people. Above that, Poway, 5 to 10,000 people. And then over in East County, because our districts have much less density, we're looking at between 0 to 5,000 food insecure individuals in those areas. So now we're going to look at April food insecurity. So you see that it really darkens down in the South Bay area and up in North County inland. Okay, let's see April. So here's where we are now. This is what we're using as our operating kind of baseline as we look forward for the next year. Next slide, please. So you can see that there's been some improvement since April, which is great. And the hunger relief community who's on this webinar should feel very, very proud of the work that they've done. It's been really incredible for us to really hold steady. Well, we'll get to that in a minute in terms of the meal gap, but it's an incredible performance. So these maps will be available for you. Let's see, what else do I want to say about that? Let's see, next slide. Okay, so we looked at food insecurity by zip. The next stage of trying to hone in on where the need is, first we need to figure out how many, we know how many people are food insecure, how many meals do we need? Next slide. So to calculate that, take the food insecure population, multiply by 3 meals a day. So this is just for August. So we estimate about 94.5 million meals are needed. We have a methodology that was created with the Hunger Free San Diego Advisory Board to estimate how many meals are self-purchased by the population that's experiencing food insecurity. I mean, most food insecure households are in need of, anywhere from, a few days of meals, a day of meals, to a week, to needing a meal a day. I mean, it really varies. So we create some very general estimates and applied the same estimate across the whole food insecure population and came up with 63 million meals self-purchased. So next we're going to look at the number of meals that were provided by food assistance, and then we can get to the missing. So total meals provided. So we are going to show you across all types of food assistance, whether they're federal nutrition programs, whether they are supported by charity, philanthropy. We're not differentiating at this point. Everything is added together. So now we can look at where our meals are going. Next slide. Oh, and before one thing to note is, especially for those who are new to Hunger Free San Diego, we use the common unit that we speak in is number of meals. So people get CalFresh benefits. It's basically a cash equivalent. So we $3.31 of CalFresh benefits equals 1 meal. 1.84 pounds of food equals 1 meal. So these conversions come from the USDA meal plans. So we needed something that we could, that would be very equivalent. And the Hunger Free San Diego Advisory Board felt strongly that we really needed to have the amount of food, the pounds of food, and the dollar amount that is representative of a meal be in the range of what would be a healthy meal. Next slide. So this is a look back. This is the slide that we had for our 2019 State of Hunger. So if you haven't seen this before, it's a lot to take in, but basically within each of these pie pieces, we gathered data. The Hunger Free San Diego Advisory Board members provided their data. And in this case, it was by year. Now they're providing it to us by month. So this is data from Health and Human Services on CalFresh. It's data from WIC. It's the senior meals that are funded through Aging and Independence Services. It's meals that are provided through the food banks, whether they're funded by philanthropy or funded by the federal government, and additional pantry meals that the pantries have their own food drives and purchase their own food above and beyond what is provided by the 2 food banks. And so we have a methodology for calculating, for estimating what that additional amount is. We have a very small sliver for the food distribution program on Indian reservations. And then we've got our child and youth meals piece of the pie. So that pie piece, so this year we have gathered almost all of this data. We're still missing the Child and Adult Care Food Program, the CACFP meals, which is not the hugest. I mean, it's a smaller, but it's a chunk of this giant pie piece. So that's missing from this current stuff. Most of this giant pie piece is the National School Lunch Program and the School Breakfast Program. And then we don't have the data yet on the federal distribution program on Indian reservations. But thank you so much to everybody who's on this call who put down all their craziness to give us data so that we could all look at this together today. Next slide. So here's what food assistance looked like in 2020. This is a draft again, because we're missing those 2 sources of data. This is based on number of meals. Next slide, April. So we really picked it up. Look at the, can you go back to January? And look at East County, go ahead to April. So really kudos to our hunger relief sector for really expanding their outreach into East County. You can really see that change. Let's go to August. Okay, so that's where we are now. Again, we're gonna make this available to you. I don't know if this one will be available by the end of the week because we're missing a couple of data pieces. Maybe we'll put it out as a draft just so you all can chew on it, because I know that you want this data to inform your planning, et cetera. Next slide. Okay, so we got the number of food insecure. We know how many meals they need. We know how many meals that we've provided. Now we're looking at the gap. Next slide. So right now, and again, this is a draft, looking at August, total need 94.5 million meals, 63 million meals estimated to be self-provided, 25 million meals from food assistance, leaves us with a meal gap of 6 million meals for the month of August. Next slide. Just another way of looking at that. So what I was starting to refer to earlier is that what an incredible job we've done, because last year, or I guess when we were presenting the 2017 food gap, the average, it was about 69 million meals. So really like around, 6,000 to 7,000 meals a month missing. So for us, for the hunger relief community, to be able to have kept the meal gap from growing exponentially since COVID hit is just incredible. It's just amazing. Next slide. So again, this is a draft, but I think this is really what we're all looking for, right? What is the meal gap by district, or sorry, by zip code? That enables us to then start diving into, all right, let's look at Escondido. Look at these zips up here in Escondido and inland North County. Look at the number of meals that are missing that we would need to close the gap. And then we can start talking about how we might go about doing that, given the fact, given that we now know the volume that we're trying to provide. I will call out that the yellow means that there's no meal gap. And I think when we do another iteration of figuring out the number of meals that are needed and do a little bit more articulating of like the various levels of need within the food insecure population, right now it averages out to about every single person in the food insecure population needs 1 meal a day. That's like how it kind of penciled out. But we know that that's not true across all households. This is a generality, right? This is where we start. So we know that there is still tremendous unmet need in the East County areas. And so just want to, this is just a preliminary first draft look, but I just wanted to share where we're, where we are with it. Next slide. The other thing that we are doing, and is the next thing that we're going to be talking about at our next Hunger Free San Diego meeting, is how do we start flagging different areas by vulnerability or other factors. So, for example, if we want to undo the impacts of historical racism, then we have to prioritize communities of color for investment when we're looking at addressing food insecurity. Other things that we can do that we're doing this all like by zip, other things we can do is look at other risk factors that may contribute to food insecurity or an inability to connect to resources, such as not speaking English very well. So this is a census field. I'm not saying that, this is just simply an example of how we might start to create a vulnerability or a prioritization index by mapping some things and then doing crosshatching or some other types of indicators of other factors that we know are going to either make it difficult for people to connect or have been historically connected to food insecurity, like a large population of single parent households. Next slide. Okay, so we talked, before we get into what are we going to do about that meal gap, let's just take a quick look at at the path in front of us. Next slide. So this is the slide that you already saw. That's the shape of the curve. We're about to look at some projections where 2020 is just a little, it's just from January to August, and it's a straight line. So next slide. This is what the COVID curve looks like when it's squished. Next slide. So This slide shows you the recovery since the Great Recession. So in 2010, our food insecurity rate was 31%. So we didn't see food insecurity really start to drop significantly until 2016, 2017, 2019, we got down to 23%. And then we have our COVID spike. Next slide. So what you just looked at took you right up to August, which is like the halfway point of this graph. I know it's a lot to look at on your computers, but 2010, there's the path. So with our current modeling being based on unemployment and taking into account that the Congressional Budget Office anticipates that the US is not going to return to pre-COVID unemployment levels in the next decade, we're looking at a really long period of time with very elevated food insecurity levels in our region. Next slide. So how can we close this meal gap? Next slide. I'm going to try to speed it up. So this is another way to look at. So as we start to think about like, how can we close the gap? And we start to think about, okay, well, what are we using and where are there opportunities within these different pies to provide, or different pieces of the pie to provide more meals? Let's just look at August. So this is this pie chart. This pie represents all meals needed. It shows the green would be the portion that are estimated to be self-purchased. Then we've got our CalFresh meals. Orange is food distribution. Yellow is school meals. WIC is green. Senior meals is a little sliver in there. And then we've got our meal gap of about just about 6.3 million meals for August. Next slide. So when we start to look at like what happened, there's quite an interesting story to tell. When you look at January, you see, I just want to call attention to the gold. So school meals, and you remember from that pie chart, was like almost a quarter of our food assistance meals provided. When schools closed, it dropped dramatically. In April, it was amazing that the schools were able to provide as many meals as they did, but look at August. Thankfully, by heroic measures, our food banks and pantries and all of the agencies and entities that are providing food distributions right now have helped to close the gap left by the drop in school meals. Next slide. This shows it even more dramatically and also gives you a sense of the relative number of meals coming from each of these areas. The other big shift was when some of the things that Susan Davis fought for at the federal level to make CalFresh as easy to get as possible right now helped to really boost our CalFresh enrollment. So between food distributions doubling and then CalFresh skyrocketing, that's how we were able to keep our meal gap from like getting so much worse than, as worse as it could have been. Next slide. So we will be updating data like this on a quarterly basis. What we want to do is provide data and GIS maps for all of you on demand, like with a week turnaround. We're not quite there yet with capacity, but that is where I want us to be in the next 2 to 3 months, so that City of Chula Vista can say, hey, can you please just give us the stats for Chula Vista. Let us see what the meal gap is. Let us look at just those zips and let us really hone in, and so we can do a zoom in on that and give that to you to support your work. And then we're going to do, instead of just waiting for the annual State of Hunger, we're going to be doing quarterly Hunger Free San Diego public briefings. Next slide. So with that, we're going to switch over to a little less, hopefully a little bit more tangible approach to how we can move forward to close the gap. And it is my pleasure to turn it over to our Vice President of Programs and Chief Program Officer, Amanda Schultz-Brochu.
Thank you so much, Anahid. Yeah, I appreciate everyone taking the time to be with us today to learn about the data that we've been able to pull together. I think we're in a really unique position to have such a clear understanding of what food insecurity looks like across our region. And hopefully this information paired with information around what our hunger relief sector is doing and where we're seeing opportunities will really provide us the opportunity to take even further action to reduce food insecurity across San Diego County. I just wanted to start with, I think Congresswoman Susan Davis really said it best when she recognized that so many of you and us were the first to respond, and there's still more that needs to be done. So we're so grateful that you are all with us today. Okay. So just over 3 years after our initial convening of the Hunger Free Advisory Board, COVID really tested the strength of our hunger relief system. And San Diego organizations responded resoundingly with a commitment to each other and our communities. So we pivoted, some of the things that we learned and that we're hoping will continue to be able to expand upon is that our ability to pivot our communication systems, focusing on ensuring that we were staying on top of the rapidly evolving political landscape and bringing as many resources to San Diego County and San Diego County families as possible, all while keeping the public informed as our service models rapidly change to meet the demand for contactless support. We were also able to leverage our existing networks to coordinate our efforts. And a great example of that being the Hunger Free Kids COVID response team, which is a group comprised of the nutrition service directors representing all 43 of our school districts across San Diego County that came together weekly at the very beginning of the pandemic to support one another really at the highest point in our acute need in making sure that we were getting meals out to as many families as possible. And finally, the relationships that we had in place prior to COVID allowed us to share resources across organizations. And so when our amazing partner 211 really needed to pivot their resources and focus on families that were calling in with general requests on information related to the pandemic and COVID, we were able to set up systems that allowed other CalFresh application assistance organizations to take those calls and ensure hundreds of families were able to quickly enroll in CalFresh while San Diegans received access to critical pandemic information. And this is really the power of working together. Next slide. So in addition to building upon our existing relationships, our sector continues to respond to COVID by strengthening and expanding our existing infrastructure. So I think you've heard about some of the amazing work that's being done, and just really succinctly wanted to share that during the height of COVID, our food banks doubled their collective distribution across San Diego County. This came from a combination of private donations, federal funding through the CARES Act. We had a new federal program through Farmers to Families food boxes, all of which came through this amazing infrastructure that's been developed across San Diego County. Similarly, our senior meal providers increased meals delivered to seniors and individuals who are homebound by 50%. Schools also became anchors for nutrition services. They began distributing all sorts of food, including bags of food or food boxes that were going out to families along with those school meals. And then we also saw the number of families enrolling in CalFresh increased by 30% since prior to COVID. Next slide. Great. Perhaps most impactful is that our region collectively focused on policy change through administrative and legislative advocacy at both the state and federal levels. By working with our elected officials, the USDA, California Department of Social Services, and California Department of Education, we're able to simplify access to 90% of the food assistance coming into San Diego County through our federal nutrition assistance programs, which has made an incredible difference for those individuals who are trying to access these critical resources right now, as well as the organizations who are implementing the programs. A couple of examples of ways that we've been able to streamline services include being able to streamline the way that people are accessing food at food distributions. So for those individuals who are receiving commodity food boxes, individuals no longer need to sign for those boxes. And that was done through administrative advocacy by our food bank partners. On the CalFresh level, we've been able to make it easier than ever to apply for CalFresh by advocating to eliminate the previously federally required interview for individuals who are applying for assistance, and making sure that people who are applying can move all of that paperwork online, and reducing the amount of signatures that are needed to be able to process what can feel like a lot of daunting paperwork. So finally, none of this work could have happened without engaging our broader community. By working closely with our community members experiencing food insecurity, we've been able to better understand the need and also how to best get resources where they're needed. So working closely with our partners in education, healthcare, business, government, and philanthropy, we're able to make sure that resources are widely shared and that they're accessible to communities in places that they feel comfortable accessing. Next slide. So we wanted to share one example of the work that we've been doing with community through pandemic EBT. So this is work that we've been doing in collaboration with a number of different hunger relief partners and community members to do outreach and support a brand new food assistance program that rolled out across the state of California and here in San Diego County called PEBT, or Pandemic EBT. So PEBT, I think you've heard a little bit about earlier in the presentation, but it's a program that provided families whose children would have otherwise received free or reduced price meals while school was out, with money to be able to purchase additional meals. So unfortunately, about half of the 250,000 children who were our students who are eligible for those benefits here in San Diego County had to actually apply for those benefits directly. So by working with grassroots organizations, we were able to engage more than 100 community residents that reached out directly to 29,000 families across San Diego County and reached an additional about 30,000 families through different forms of social media or flyers and community settings, really taking a multifaceted approach to meeting people where they're at and getting this information out in ways that are accessible. That also included developing a wide array of content. And so we created materials and flyers with our partners that were then translated into 15 different languages, really wanting to get the word out to families. And to Anahit's point earlier, making sure that we're focusing our efforts on communities that don't always have access to this critical information, and particularly families for whom speak a language other than English as their first language. So while we were connecting with families and about this program, we had the opportunity to have broader conversations around what it means to access food assistance at large. And we wanted to share some of that feedback with you all. Next slide. So with all of the amazing work that's going on in our sector and by our broader community of partners, we understand that navigating food assistance can still feel really confusing, and in a lot of cases, people who are experiencing food insecurity and needing to access resources aren't sure where to start. So what we learned through our PEBT pilot is that while resources exist, there are additional barriers beyond awareness that prevent people who need assistance from being able to access available resources. Some of the common barriers that we heard about include primary language spoken in the household. So for those families who don't speak English as a first language, the resources and information out there may not be accessible, however wonderful they are. Misinformation around these different programs and who's eligible and where to go to get assistance. Uncertainty, stigma, or fear about accessing services, particularly in our immigrant communities. And then programs can feel difficult to access or confusing to navigate once people get connected. So again, while we know our organizations have been doing amazing jobs on the front line, as we think about continuing to chip away at this gap, it's been really beneficial to connect directly with people who are accessing services and hearing what additional changes would help us get information out and more importantly, connect people directly to services. All right, so I think, the big takeaway for us is that there's an opportunity here to continue to further engage communities that are experiencing food insecurity. And at the end of the day, we all really want the same thing. We want to understand options that are available to us and find the right resources that are best for our families. We want to feel comfortable with the resources that we're accessing, and we want to be able to ask questions in spaces that feel safe. We want help navigating complex systems, especially when we're providing our personal information. And we want to be able to access information from trusted sources that we're familiar with, especially in a time of uncertainty. So all of this feedback has led the Hunger Coalition to work with our partners to launch what we're calling the Hunger Free Navigator program. And this effort is really aimed to make it easier for people to learn about, access, and influence the food assistance resources in their community. Our goal is that San Diegans facing hunger have immediate, equitable, and dignified access to nutritious food assistance. And we think that this is going to take a person-to-person approach. So I'm going to take a couple of minutes kind of walking you through this information. We really think that anyone can be a hunger-free navigator, but we've created 2 tracks to get us started. So we're starting with the Hunger Free Community Navigator program, and this is supporting community residents in understanding and accessing, shaping food assistance in their communities. And we're developing this in collaboration with community leaders and grassroots community partners. At the same time, we're developing and launching what we're calling the Hunger Free Nonprofit Navigator program. And this program is being developed for individuals who are working in a community organization, perhaps already connecting people to resources, but really providing them with a broader landscape of food assistance resources and helping them feel comfortable in connecting people to services and understanding which services might work best for each person. Next slide. Great, so let's dive in just a little bit further. We're going to talk a little bit, share with you a little more detail around the Hunger Free Navigator program for community members. Really, again, our goals are to increase understanding and information sharing. And then, we also want to make sure that we're setting people up or connecting people to opportunities to shape and influence our food assistance system and making sure that it works for everyone. Unfortunately, a lot of our food assistance programs, although they're implemented incredibly well by an amazing group of partner organizations, when they were developed at the federal and state level, they weren't always developed by or considering the people that are actually using the programs, and we want to change that. So upon completion of the program, individuals will receive a certificate and recognition as a Hunger Free Navigator. They'll receive ongoing communications and access to information from Hunger Coalition. We know these programs are constantly changing and want to make it easy for people to keep up with us as we all try to keep up. And then we'll be offering opportunities for people to become hunger-free activists and engaging with us on creating systemic change through both administrative and legislative advocacy. Go on to the next. So when we're thinking about a Hunger Free Navigator program for nonprofits, again, we're thinking about probably a lot of you who are on the call, case managers, patient navigators, and resource specialists. We want to help you better understand the landscape, develop skills to be able to assess which programs are most applicable, and gain confidence in connecting people to available resources. So people will receive a certificate and recognition as Hunger Free Navigators and ongoing support from Hunger Coalition. And then lastly, individuals will receive ongoing access to online resources to be able to share with community members that you're serving. Great. So we wanted to share just a little bit of the content. So people that do take time to engage with us and become Hunger Free Navigators should expect to receive information about all of our food assistance programs across San Diego County, including CalFresh, WIC, our child and youth meals, home delivered meals, and our food banks and food pantries. And included in that will be Hunger Coalition is regularly developing updated food assistance resource flyers that we're sharing out and working with all of our providers to make sure are up to date. And perhaps one of our team members can share a link to our current food assistance resource flyer in the chat. Great. So the next question is, where are we in building and launching this Hunger Free Navigator program? So right now we are just getting ready to officially launch our Hunger Free Navigator program for nonprofits. We've created content with all of our hunger relief providers through the Hunger Free San Diego Advisory Board. We've beta tested this information with case managers and resource specialists that span the county and are working in a variety of sectors that are connecting people to resources. And then hoping to be providing trainings as early as December 1st. So we would love for you to join us. And then secondly, we're also moving forward with our Hunger Free Navigator program for community members. So we're currently in the process of convening an advisory council that is going to help us develop content, and we'll be putting together workshops in early 2021. All right, so putting the pieces together. I'm so sorry. We've got this amazing data. We're building even stronger networks and bringing together additional resources to San Diego County. So how are we putting all of this information together? At the end of the day, we want people to feel comfortable talking to each other about food insecurity and know where to go to get help. We want every affordable housing complex, senior center, library, school, clinic and hospital, and place of worship to have hunger-free navigators that can help people connect to resources. We also want to see that every municipality has a designated hunger-free navigator that can help residents both identify and navigate local food assistance resources in their areas. And we know that this is going to take everyone. Next slide, please. Excuse me. Finally, as we're pulling together all of this information and amazing data, we want our hunger-free navigators to be armed with as much detailed information as possible that around both the need and the food assistance resources in their immediate communities, so that they can be helping get the word out and can make it easy for people to be aware of what's going on right in their backyards. So navigators are going to be in positions, with this information and with these connections. Our goal is that navigators are going to be in positions to influence the development and implementation of food assistance programs moving forward. And ultimately, we want to see that all San Diegans have access to safe, nutritious food assistance that's there when they need it.
So we just spent just almost an hour and a half going through reviewing a snapshot of hunger. It's the state of hunger is such a rapidly evolving situation that we almost, maybe we should have called this event the snapshot of hunger. But so we talked about it from the macro level, looking at the food insecurity data and the needs and how much we're providing, and starting to get a sense of the gaps and the size of the gaps and where they are. And then you've heard about the state of hunger from a little bit more of the micro level, at the neighborhood level, and what is actually happening on the ground with our different organizations and our partners, and what we're looking forward to moving forward. The purpose of this event is to share the information that the Hunger Free San Diego Advisory Board and the Hunger Coalition have been putting together. And over the next few months, the advisory board will be working hard on creating some plans and some priorities that we can share more broadly with the community. But in the meantime, I'll let Amanda share with you about how you can get involved with creating a hunger-free San Diego.
Thanks, Anahid. Yeah, so there's a number of different ways that everyone can get involved. I think just coming here this morning and spending 90 minutes of your morning with us is an amazing step, and learning more about what's going on in our county and how to engage. And so we'd love to continue to engage with you as we collectively continue to chip away at this gap. So, first we invite you to continue to learn more about hunger in San Diego County as we continue to release new information and do further analysis with our partners. We would love for you to join us in those efforts. Also sharing resources with people who are facing hunger. So as we get ready to launch these new Navigator programs, we'd love for you to join us and participate in these efforts. So become a Hunger-Free Navigator with us. And then the first step in really being a navigator is sharing those resources. And so as the holiday season approaches, we'd love for you to help us get word out there around where people can access food assistance. Additionally, adding your voice as a hunger-free activist. We heard from Congresswoman Davis about just how important both administrative and legislative advocacy is right now, in making sure that our sector has the resources it needs, and that those resources are getting directly to all San Diego County residents. Also donating. So every dollar really helps, and we greatly appreciate all of the financial support that's giving us the time, energy, and resources to be able to do this work together. And finally, volunteering with local hunger relief efforts. We know that right now it's particularly challenging for those organizations who are on the ground and were previously reliant upon volunteer bases that may not be able to get out due to the high risk related to COVID. So if you have time and energy, please consider further engaging with us in one of these ways.
So with that, we will turn it back over to our Director of Development, Georgia, who will close us out.
Thank you, Anahid, and thank you everyone so much for joining us today. Again, spending 90 minutes of your morning during these very busy and stressful times. We're so grateful for your support and your partnership. We know there's a lot of useful information in this presentation and we have recorded it. So keep an eye out for an email with the shared recording. You also will be directed to our website when the broadcast ends. That will have useful videos, the food assistance flyer that Amanda had referred to, among other resources that we really encourage you to explore and share. Again, this is a community effort, so please share the information that you've learned with your family and friends over the holidays and into the incoming year, as we still have a lot of work to be done. But thank you again, and we hope you have a great rest of your day and wonderful week.
Thank you, everyone.